As the panel begins to assemble, I'd like to introduce myself as the Reverend Dr. Khadijah Abdul Matin, or better known as Mama K. I'm one of those baby boomers that's on the closer side of 65 than 50. And as we get ready to talk about end-of-life care across communities, I'd like to just remind us that end of life does not only mean for those who are the elderly or in advanced years. I work at Lutheran Healthcare, and sometimes we have to see the young infant. We have to see the adolescent, or the 30-year-old who thought she had her life ahead of us. So I would ask that as we embrace the topic today and as we give it thorough thought, that we think of all the ways in which, as we're inspired by our previous speakers, but that we think about that end of life occurs through all the phases of life. And one of my first cases as working as an on-call chaplain was to escort the mother to the morgue with her newborn infant. This is what the work that we all do, and this is the spectrum that we need to hold dear to us and consider as we look at end-of-life care. I'm going to just briefly introduce the presenters because I think you need to hear from them, and I also want to allow for time for question and answer. If I mispronounce your name, correct me, all right? The Venerable Pema Wanda, did I say that right? All right. One of the most well-known, he's a Tibetan teacher, has extensive experience and has been doing this from when he was very, very young, and guides Western students for over 30 years teaching across the country. We have Dr. Khalid Rehman, who's a physician, and is currently a member of the faculty of New York Medical College. He's written extensively on issues pertaining to end of life, both from the medical perspective as well as the Islamic faith perspective. Dr. Uma Masareka, okay. Tell you, I'm special, you know. She's been practicing OB and gynecology in Flushing, Queens since 1975, but also is the president of the Hindu Temple Society of North America. And then is Babalao. See, I know, you know, some of us knew each other when we had other lives. Babalao, someone who I've known for a long time, and is nationally respected as an Ifa priest and spiritual counselor in the Yoruba Lukumi tradition, which is an African traditional religion. He's the Interfaith Director for the state of New York for the Church of Lukumi Babalao Ai and the Associate of the Ifa Temple of Los Angeles. He brings a wealth of experience and has also completed clinical pastoral education as well. So he brings the bridge of the role of chaplain and the role of the African traditional religions. Ladies and gentlemen, let's welcome our panel. Come on, come on. And we'd like to start with the doctor. Could you start?
Sure. Good morning.
Good morning.
Good morning. Can you hear me okay?
Yes.
Thank you. So, Khalid Rehman.
Speak to the microphone, please.
Okay.
So we can hear you.
Just pull it close.
Okay. Thank you. Is that better?
Yes.
Okay. So, as I understand, the role of the panel is to share with you some of the issues related to the end-of-life care, and I'll speak to the issues that arise in the Muslim faith, and then we will have some Q&A, and I'll be available during the day if anybody has any particular questions about it. So very briefly, the issues that arise around the time of death or towards the terminal illness, has been pointed out earlier, are symptom management. The most distressing part is the the symptoms that the patients feel or the individuals feel towards the end of life. And a very large part of that is pain. And as I define it, and many other experts have defined it, pain is very encompassing. It can be physical pain, it is spiritual pain, it is financial pain, existential pain, all kind of issues that arise at that time. And certainly the physical pain is somewhat easy to manage, even though many of the medical professionals are still learning the art of managing and taking care of the physical pain in a setting, either be at home or in a hospice or in a hospital. But there are many other types, as I mentioned, which need to be addressed, and that's where there's the team, as it is in a hospice or in a community, where you bring in the spiritual guides, the imams or the clergy, to help with the spiritual pain. You know, what I've done, where am I going, if I've sinned, what's going to happen to me, punishments, rewards, issues such as that. Financial pains are very important. As I teach young doctors, I'm a cancer specialist. Besides taking the medical history, I like to know their personal stories, I like to know their affiliations, and I'd like to know their families. Do they have young children, teenagers? What are they thinking about it? Is this person worried about where the next paycheck is going to come or not? And are the children worried about getting a new uniform or sneakers and so forth? So this is all part of that issues that arise at the end of life, which we, the physicians, very often forget. We are very focused and very well trained to take care of the physical illnesses and the cancers and the chemotherapies and all that, but where we miss out is on the social, the psychological and the emotional components towards the end of life. And many a times ignoring these leads to unfortunate things such as suicide or mercy killing, or patients asking for help in ending their life. In Islam, suicide is not allowed, is not accepted, and so is mercy killing, which is not accepted. And this is all supported by the texts. Life is a gift from God, and it cannot be taken away by God, by humans. It's a gift given by God and can only be taken away by God. There's a verse in the Quran on the 4th chapter which says, "Do not kill or destroy yourselves, for verily Allah has been the most merciful to you." Death in Islam is ordained, as has been pointed out from the very beginning and very first sentence spoken this morning, is that we all have to face it. And it cannot be hastened and it cannot be delayed. And there are multiple verses in the Quran, in the text, which relates to the fact about the death and its certainty. And if anybody's interested, I'll be able to share those with you. From a medical perspective, around this time, the definition of death becomes an issue. From a religious perspective, the Islamic Medical Association of North America, of which I'm a life member, has been working very hard in developing the ethics and addressing the issues around death and the definition of death. There are, in the Islamic tradition, we are allowed to debate, discuss, and come up with solutions which are not directly and clearly addressed in the Quran, which is the holy book. So there are things that are not mentioned, organ transplantation, artificial hydration, artificial feeding, do not resuscitate, the kind of issues which are not directly and openly discussed in the Quran. We as the community and as the professionals can get together, discuss, and come up with the best solutions and best answers. To that effect, the Islamic Medical Association of North America has been very helpful and practical in holding these seminars, and they have published and they are openly available to the public and to the medical professionals, particularly of those of the Muslim faith, to understand as to what is the current understanding and what we think is acceptable. The brain death is an acceptable form of death in Islam, at which point one can say that the individual has died. And I'll just share with you very briefly a verse from the Quran, which is very interesting to me, because it says to the fact that when we go to sleep, we actually die, in a sense. Let me just read you, and this is somewhat paraphrased from chapter 39. It is the God that takes the souls at death. During sleep, He holds on to the souls of those on whom He has passed the decree of death. To the rest, the souls return after sleep, and they live for the appointed term. Verse 42 from chapter 39, meaning that when we go to sleep, the soul kind of wanders around, leaves, and if it has been determined and decreed that we have died, then soul never comes back, goes back to the Lord. And if we are to live, and then the soul comes back, we wake up and we go on with our daily activities until the term that has been appointed. So, and we also understand from a medical perspective and scientific perspective that the soul or the spirit works through the brain, and the brain controls the body function. So when the brain dies, and what I mean by brain is all the brain dies, the upper brain and the lower brain. Lower brain is the primordial brain, the brain that keeps the heart going and the breathing going, and the upper brain is our thought process, pain, understanding, the frontal lobe and the cortex. So when all of that brain dies, and we can show that on scientifically, then in an Islamic perspective, the person has died, at which point then the death certificate, the organ donations, which are acceptable in Islam, since it helps the humanity, it helps heal those who are sick. So those are the things that can be carried out at that time. Within the institution, just very briefly, if somebody dies in a hospital, there are no special requirements that somebody stay with the body, although like all the other faiths, the dignity of the deceased is important. Women, female deceased should be handled by a woman worker, so that the family is not disturbed, which is, again, immediate burial is recommended in Islam. But if an autopsy is required or organ donation has to be done, then that can be carried out with the understanding of the family. And there is no religious prohibition against these things. It's all because of the local needs. Similarly, embalming is not practiced. Immediate burial has to be done unless, of course, the body has to be transported or the local health laws require that the body be embalmed. The burial is done in a very simple coffin. In fact, in many of the Muslim countries, there is no casket, there is no coffin, there is just a shroud in which the body is wrapped up, and a hole is dug in the ground in which the body is laid, and the dirt put on it. But again, it is also allowed in local areas, wherever you happen to be, you have to follow with the local laws. There is a process at the time before burial. The body has to be bathed, and that is facilitated by the local communities. You do not require an imam or anybody can do that as long as you have a clean place to do that. But we do have facilities through our mosques in which somebody will come and assist in bathing the body. Again, men bathe the men and women bathe the women, and after that they're shrouded and put to rest. Usually there is a prayer, and it is always a community prayer. Anybody in the community can join and is actually encouraged to join the funeral prayers in Islam. Anybody happen to be at the mosque, and again, the funeral prayer does not have to be at the mosque. It can be in the cemetery grounds. It can be anywhere where before laying the person down in the ground, prayers are offered. And the issue usually in the community for those who are community activists is the resources available for families for burial. Again, we don't need an expensive casket, so that cost can be brought down, but still there are costs associated with it, and there are immigrant families who may be lacking those resources and funds and whatnot to take care of it, or the body has to be transported somewhere. So there are community organizations within the Muslim community which will provide assistance. They'll come wherever they have to come to help bathe the body, provide the cloth, for the shrouding, and assist in getting a plot or a spot in a cemetery where the person can be buried. So I'll stop here, and anybody who wants to discuss like the ethics from a medical perspective or issues regarding the end-of-life care, I'll be glad to discuss it with you, and we'll provide you reference to the IMANO, the Islamic Medical Association of North America, where you can access those who need to the ethics regarding the end-of-life care. Thank you.
We're going to proceed with each speaker and then have the Q&A immediately following. So be sure to take notes for any questions that you might have.